All right, so let's talk about disease stages, signs, symptoms, and transmission routes. It's kind of, a potpourri of different ideas, but just to kind of get them all together. Okay, so let's start with disease stages. Basically, you've got 5. You have incubation period or incubation stage. You have prodromal period or prodromal stage. Okay, you have disease period or disease stage, decline, and then convalescent stage. Okay, so what does that mean? What happens during incubation period? No signs or symptoms. During prodromal period, you start feeling crappy. So mild signs or symptoms. During the disease stage, full-blown signs, very scientific term, symptoms. Now, here's the thing. For some infections, obviously, there is a side route here. Look, at the peak of disease, people can die. Well, technically speaking, they can die anytime here, all right? So during the decline, usually symptoms and signs go down. And during convalescent period, people may experience what's called sequelae, consequences, okay? So I'm going to use, and coronavirus provides such an incredible example to go over these ideas. So let's say somebody is infected with coronavirus, right? So during incubation period, people do not experience any signs or symptoms, and then they start maybe a little bit of a sore throat, a little bit of a headache, maybe mild fever, stuff like that. That's going to be your prodromal. Then, and I'm going to take it kind of not too easy, not too bad. So eventually they develop full-blown symptoms and signs, meaning that they have shortness of breath, they have high fever, they have headaches, they lose sense of smell, all classic symptoms of COVID. Okay, let's say they don't go into the hospital. Okay, so eventually their breathing capacity is restored. Okay, fever is gone, right? All those aches are gone. So that's going to be decline phase. In the convalescent phase, now they tested negative, they don't have any detectable RNA, okay? Now, what does that mean sequelae? They still didn't get their sense of smell back. That's a sequelae. Many people report continuous tiredness, fatigue, and shortness of breath. That's the sequelae. Some people report brain fog or certain mental disorders. That's all sequelae. What's now is called long COVID. Does that make sense? Now, it's not necessarily true for all the diseases. Like, let's say, for my favorite norovirus infection, very short incubation period, like day maybe. Prodromal is like hours, then you go on the shitter for 2 days, and then you're completely fine, nothing else, okay? So like, no sequelae whatsoever. Does that make sense? Now, what about the graph that you have in the notes, which shows you how replication of the pathogen perfectly coincides with the severity of symptoms? Not necessarily. Now, I'm not going to put this in the print. I just want you to understand this. For instance, for why there's such a big difference between SARS-CoV-2 and SARS-CoV-1. In SARS-CoV-1, in the first coronavirus in 2003, the more severe symptoms corresponded to higher levels of virus replication. Does that make sense? So when people were really, really sick, they most actively transmitted the disease. With this virus, we see the opposite. The peak of viral replication is here, between incubation and prodromal. When you start feeling sick, the virus titers in your respiratory tract, they start to decline. By the time people end up in the hospital, many of them barely have any detectable virus. It's the consequence of the virus. Does that make sense? So we didn't talk about it when we talked about the mechanisms of like what causes pathogenesis. But for many viruses, it's what's sometimes called cytokine storm. So your immune system responds to the infection in such a way that it is overactivated, it is very active, it leads to too much damage. It tries to clear up the virus but causes too much damage. Does that make sense to everybody? Okay. This is why, for instance, what's the main course of treatment for patients in the hospital with the respiratory deficiencies with COVID-19? Steroids, immunosuppressants, just to calm down the immune system. That makes sense? Now, what is the difference between the signs and the symptoms? So signs are objective. Okay? Meaning that you can say diarrhea, not self-reported diarrhea. Clinic, like you have a patient, you look at the sheets, oh yeah, we have diarrhea here. Or rash, or increased blood pressure, changed blood cell counts, fever that is measured, not perceived, measured, okay? Symptoms are subjective. You should be able to distinguish between the two. So symptoms are self-reported, obviously. When somebody says that, look, here's the thing, if I come to the doctor's office and I say, oh, I have nausea, that's a symptom. If I walk in the doctor's office and I throw up, that's a sign. Because they can see it. There's an evidence to it. You see the difference? So you should be able to tell them apart. There will be questions about it. Now, I'm going to introduce certain ideas about the transmission. And as I mentioned before, in epidemiology, it's often a little bit elusive. The definitions are a little bit elusive. So first, I want to compare the host versus reservoir. Okay, necessary for maintaining the pathogen. I'll explain what it means. Now, host is the organism that hosts disease. Let me explain the difference. Everybody is familiar with rabies, right? You've heard about it. So, humans, are we hosts? Yes. We can get sick with rabies. That makes sense? That makes sense? Now, where do we get rabies in Ohio? Mostly skunks and raccoons. The virus is maintained in a population of skunks and raccoons. If we, hypothetically, say we vaccinate, which is possible actually, all skunks and raccoons and foxes and coyotes in the state of Ohio, every little carnivorous creature, okay, we vaccinate them all, virus can't reproduce in them, does that make sense? And it disappears, which tells you that all those carnivorous creatures were the reservoir. Basically, the test for reservoir if you kill a particular animal, like get rid of it, will the microorganism be gone? Does that make sense? So, for instance, for coronavirus, SARS-CoV-2, now, what is a reservoir? A human's reservoir? Yes. Is that the only one? Probably no. Most likely bats, maybe other animals, right? So it's really hard to determine the single reservoir. For measles, for example, the only reservoir are humans. If you kill all the humans, you will get rid of measles. Or immunize all people, you will get rid of measles. Does that make sense? Are we hosts at the same time? Absolutely. The same animal, the same organism can be the reservoir and the host for a disease at the same time. Do you see the difference? Okay, so that's this conversation. Now, another important concept here, vector. Vector is a transmitting animal. Usually it is arthropod, either insect or arachnid. So vectors can be biological or mechanical. Putting this into a short statement will cause me a lot of trouble, like I can't do that, but I'll explain what's the difference. So imagine that you are at the campsite, okay, in National Park, and there is a toilet, not flushable toilet, just an opening. So there's a lot of flies, right? These flies will land on the feces, and they will fly around, and they will find your food and land on the food. So on their little legs, they will move whatever bacteria were in the feces onto your food. It's a this is the mechanical vector, just simply carrying the stuff. Biological vector implies that a pathogen, a microorganism, is inside the arthropod. You see what I'm saying? So basically an arthropod has to sting you or bite you, take a blood meal. Let's say you get bitten by a tick. You get Lyme disease. Lyme disease was present inside the tick. Borrelia burgdorferi was reproducing within the tick. Does that make sense? You get bitten by a mosquito and acquire malaria. Malaria was reproducing inside a mosquito. You get West Nile virus. West Nile virus was reproducing inside a mosquito. All of these are examples of biological vectors. Are we clear? Which brings us to a couple of concepts with the transmission route and carriers and fomites and vehicles. So first, let's talk about carriers. So what are carriers? Humans. For our intents and purposes, we consider carriers humans. Carriers can be, there's a list in the notes. Not going to put here, have your notes. Let's just work it out. So, human that is asymptomatically infected, asymptomatic carrier. We see it all the time with SARS-CoV-2. Incubation carrier. This is why testing was so important and is so important. When somebody doesn't have the disease yet, you see what I'm saying? They are in the incubation period, they can still transmit the infection. So incubation carrier. Chronic carrier. Famous, what's her name? Typhoid Mary. It's really hard to say whether she should be considered asymptomatic or chronic, but I can use it as an example of a chronic carrier. She was chronically infected with salmonella, and she was transmitting salmonella to other people. Does that make sense? Like for the rest of her life, like for her entire life. Okay, so chronic carrier. Passive carrier, which is you work as a doctor, you check a patient, and then you accidentally carry the pathogen from one patient to another. That makes sense? And convalescent carriers, so people who are already fine, like they don't feel anything, they recovered, but they still can spread the infectious agent. My favorite norovirus is an example. People who recover after norovirus infection, they actually shed virus for about 2 weeks post-recovery, 2 weeks post-convalescent period. Does that make sense? So they still can transmit it to other folks. So far so good? Okay, now, a couple more concepts here. Vehicles. Versus fomites. It's not versus. Inanimate objects. So you can get a transmission from a fomite, right? From a doorknob, from a faucet. From a toilet seat. It's all fomite. Okay? Remember how everybody, well, doesn't include me, but people were like bleaching groceries. Oh, stupid. Fomite transmission. Very, like, disappearingly small contribution to SARS-CoV-2 transmission. Okay? Now, vehicles, basically whatever you get in, food, water. Okay? So, for instance, a lot of gastrointestinal diseases are transmitted via vehicles. Okay? Which brings us to kind of a conclusion of that conversation, the routes for transmission. So transmission can be direct, indirect. Okay, so direct transmission is very straightforward. You have contact transmission, which is basically bodily fluids. Okay, that makes sense. Then we have respiratory transmission. Obvious question. What's the difference between respiratory and contact? Like, if we are in the elevator and I start coughing, my mucus flies all over the place, lands on your mucosal surfaces, and you can acquire disease from me. Which type of transmission it is? This is where it gets really sort of gray area. Generally, it is considered that droplets that are higher than the bigger than the certain size, it kind of falls in the category of droplet contact transmission. You have to be close to the person. Does that make sense? Respiratory transmission implies that there is an aerosol which is formed by tiny, tiny little droplets. So basically, you can think about it this way. If I is with the same room with you, and I do not cough, and I do not sneeze, and we just breathe the same air, and you still can contract the infection from me, this is the respiratory transmission. So kind of, again, projecting it to coronavirus, is there a respiratory component? Is there respiratory transmission? Absolutely. Does it contribute a lot? Not too much. Mostly, those are large aerosols with large droplets that are generated when we speak, when we sing, when we cough, when we sneeze. This is how it is transmitted. This is why masks work. Does that make sense? Otherwise, if that would be breathing, regular cloth mask would not help as much as it does. Okay? Does that make sense? Vector transmission is also considered to be direct. Now it's interesting. We say direct. Look, direct means from one organism to another. So for instance, yellow fever, look, yellow fever can be directly transmitted from person to person. Okay? Mosquito bites a person who's infected, then bites a person who's not infected. West Nile virus can't. It can be directly transmitted from a bird to a human. But if I have West Nile and I get bitten by a mosquito, this mosquito cannot infect anyone else. It's not directly transmitted between people. Does that make sense? And vertical transmission, transplacental or congenital. So from mother to child, okay, that makes sense? Either, now the pathogens that are transmitted transplacentally, sometimes referred to as torch pathogens, which people would probably pay a lot of money to change this acronym. Torch stands for toxoplasma. Others, rubella, cytomegalovirus, and here you have herpes, hepatitis, you know. Others are just like others. Stuff that we couldn't come up with for a good acronym, just threw it in others, like syphilis. Okay? Again, that's transplacental, but it also can be congenital during the passing through the birth canal. We're good so far? Now what about, indirect transmission? Fomites. So, doorknobs, toilet seats, that's considered indirect. Vehicles, also considered to be indirect transmission. This one requires some explanation. Aerosols. This is the very, very specific. So, remember we were talking about Histoplasma capsulatum, the fungus that causes histoplasmosis, the lung infection. You acquire it when you inhale aerosolized spores that used to be in the feces of birds and bats. This is an example of indirect aerosol transmission. So an animal has to shit, then this shit has to be aerosolized, then you have to inhale it. I don't know how many of you have heard recently there was a case of hantavirus infection in Michigan. Okay, hantavirus is transmitted when mouse poop is aerosolized. People inhale that aerosol, develop lung infection. Does that make sense? So this is the difference between that aerosol and that respiratory transmission. We good?